choosing a private hospital over a public one can have some benefits and drawbacks for NHS patients. In this section, we will explore some of them. One of the main benefits of choosing a private hospital is that you may have a shorter waiting time for your treatment. The NHS has a huge backlog of patients waiting for elective care, which means that some people may have to wait months or even years for their surgery. By using the NHS app, you can check how long you would have to wait for both NHS and private hospitals, and book your procedure at whichever best suits you. This way, you can get your treatment faster and avoid the risks of delaying your care. Another benefit of choosing a private hospital is that you may have more choice and control over your care. You can choose which consultant will treat you, which hospital you will go to, and when you will have your surgery. You may also have access to more facilities and amenities, such as a private room, better food, and more visiting hours. You may also have more continuity of care, as you will see the same consultant throughout your treatment. However, choosing a private hospital also has some drawbacks that you should be aware of. One of them is that you may not have access to the full range of services and specialists that the NHS offers. For example, if you have a complex condition or need emergency care, you may be better off in an NHS hospital, where you can benefit from the expertise and equipment of a multidisciplinary team. Private hospitals may not have the same capacity or capability to deal with complicated or urgent cases. Another drawback of choosing a private hospital is that you may not be covered by the same standards and regulations that apply to the NHS. For instance, private hospitals are not subject to the same inspection and rating system that the Care Quality Commission uses for NHS hospitals. This means that you may not have the same information or assurance about the quality and safety of your care. Private hospitals may also have different policies and procedures for dealing with complaints, infections, or complications. In conclusion, choosing a private hospital over a public one can have some advantages and disadvantages for NHS patients. You should weigh up these factors carefully before making your decision, and consult with your GP if you have any questions or concerns. Remember that you have the right to choose where you have your treatment, and that you can use the NHS app to book your operation at a private hospital if you wish.